Hello and welcome from all of us here at Dorothy House. My name's Kirsty and I'll be your online host today. In this webinar, we'll be answering your questions about providing palliative and end-of-life care during the COVID-19 crisis. I will now hand over to Jenny Steele, who'll be chairing today's session and can introduce you to our panel of experts. So over to you, Jenny.
Thank you, Kirsty. And again, thank you to absolutely everybody that has logged on to our very first webinar at Dorothy House. We're very excited about it. My name is Jenny Steele and I'm the Head of Communications at Dorothy House. We'd like this to be a real opportunity for you to ask our panel any questions that you might have. Please don't worry if we don't manage to get to your question. We will, after, be looking at the questions and noting answers, and we'll be publishing those on the website. We'll try and get to as many questions as we possibly can. There may also be some questions that we can't answer straight away, but we'll really try our best to get those answers to you or signpost you to those that may be able to help you. So I'd like to introduce you. Well, I'm going to get the panel to introduce themselves, to be honest. So let's start with Claire Morgan. Thanks, Claire.
Hi, my name is Claire Morgan. I'm one of the nurse specialists at Dorothy House and I've worked here for 4 years now. And prior to that, I spent 10 years in the acute sector at Southmead Hospital and Birmingham. And then the last 6 years, prior to that was as a district nurse. So yes, that's me. And I'll now hand over to Emma.
Hi, my name is Emma Frampton and I'm the Medical Director at Dorothy House Hospice. I've worked here for 8.5 years and actually many years ago I was a GP, so my background comes from the community. I'd like to now hand you over to Gina.
Hello, my name's Gina Proctor. I am the junior ward sister, but also my role at the moment is infection control. And I worked at Dorothy House for 5 years, but I've been a nurse for a long time. And I have worked in care homes and I was also a nurse in the army for a long time as well. So lots of help, hopefully.
Louise?
Oh, sorry, I'll hand you over to Louise Brown.
Thank you. So my name's Louise Brown. I'm a physiotherapist here at Dorothy House. I've been here about 7 years now. I work across the community. I work on our inpatient unit. I support the lymphedema team and the exercise sessions and group sessions. So a broad range of the activities that Dorothy House offers our patients, both on site and in the community. Thank you.
That's brilliant. Thank you so much. Okay, so we have a few questions to start off with that we've been given. So I'm just going to start off with the first one, sort of about general and family, and I'm going to aim this towards Claire. How are you coping with the restrictions for family members visiting patients, and especially right at the end of life?
Yeah, it is a real challenge at the moment because it's really countercultural for us. And for patients and families. So our natural response obviously is to go towards and visit patients in their home, and for families and loved ones to visit their relative towards the end of their life, and that is a real challenge. It has been a challenge this week, particularly just personally, professionally, and I think it's about trying to find different ways of them feeling connected. So using things like WhatsApp videos for families so that they can connect, writing letters, and just using different forms of technology really. But I think also supporting family that can't visit due to restrictions by trying to help and support them with the emotional burden of that, and trying to reduce that as much as possible really. There's that sense, that feeling that they need to be there and be with their loved ones at the end of their life, and if that's not possible, it's just trying to support them in that really, and just saying actually it's okay. It doesn't feel like it's okay, but it's okay that not to be there, and also then signposting to kind of bereavement really to support them afterwards.
That's great, Claire. And just talk a little bit about Dorothy House and us still being able to take referrals, just so that might help some people for some of the bereavement resources.
Yeah, so the referral process hasn't changed. The referral process is still the same, but how we respond to that can look slightly differently. So the nurse specialist in the community was still very much there, even if at times it feels a bit more remote. Use the telephone. We're about to try that, you go to video consultations possibly as well. But I think it's important to say that we're still very much here. We haven't gone away. We're as available as we always have been. It just looks different.
Thank you. I have another question that's come in. How long does a PPE mask last? I'm going to aim that at Gina.
That's a good question. There's no actual written times about how long it lasts. So it can be sessional use, which can be a whole shift. So potentially up to 8 hours a mask will last. If it becomes soiled, moist, damaged, broken in any way, then obviously it would need to be changed. But you have to think about a surgeon doing an operation for many hours. That mask will last for that whole surgery. So they have a good life on them.
Okay, thank you. And that brings me on to about the disposal of waste, and specifically when a patient is producing or coughing up sputum. Can you just talk a little bit about that and how you would dispose of that?
So the waste that any COVID positive patient is producing, the waste needs to go into a bag, then into another bag. So double bagging your waste. Put a date on that bag and leave it to one side for 72 hours. After 72 hours, that waste can go either in your clinical waste or in your general waste. So like for our nurses seeing people at home, that the waste is being double bagged, left in the patient's home, and it can sit there for 72 hours and then just can go in the general waste. But I think the important thing is double bagging and putting the date on it so you know when that 72 hours is up.
And speaking of PPE, we're grateful to Stacey Saunders, who's on the webinar today. She's making laundry bags for our staff and scrubs for our doctors at Dorothy House, and she'd be really happy to help any care homes. So you can get in touch with her if there's anything you'd like to have made. So you can contact her through our Facebook page, and I believe one of my colleagues is putting the details onto the chat. So thank you very much, Stacey, that's brilliant. Okay, what are the main symptoms that you're seeing with COVID patients and what can you recommend for symptom control? Emma.
So the main symptoms that people are seeing are shortness of breath, a fever, cough, and sometimes people are developing excess respiratory secretions, so the very wet sounding cough and breath that we sometimes see. There are various ways of managing these symptoms, and I know there has been some concern about, what if we can't get the injectable medicines, what if we don't have syringe drivers? We're looking at all of that. One of the things we have produced, which you can access through our website, is some symptom control guidelines, which we've produced with BSW. And they give a whole range of medications. I'm really happy to talk about it, but it might be helpful if you refer to that. I'm happy to take any specific questions, but there's a whole range of medications varying from the oral to the non-oral, non-injectable, through to the injectable medications that you can give patients to relieve symptoms.
Thank you. I'm going to ask Claire about, and how else can you manage pain? I mean, if you're not able to use a syringe driver, what are you doing out in the community at the moment?
So we're always going to use our step-by-step approach anyway. We need to, good assessment is the crucial thing really. And because COVID adds another layer to our already complex patients, really what we're doing is treating the symptom, and it's treating the patient as an individual. So if the patient is alert, orientated and able to take oral medications, then we're always going to use that as our first option. And it will always use the analgesic ladder for things like pain. Breathlessness, or a morph liquid is often the go-to for that. But oral medication, if it's not an option, we already use patches, for example, so we can think about that. But we're always having to balance that anyway in the community in terms of district nurses, availability, capacity, and also the availability of syringe drivers. So we are thinking ahead, we're anticipating good relationships with the patient always, so that we can anticipate any change, and yeah, we can use the tablets or patches.
Where could people get advice if they needed to call in and get some advice on that?
So the first port of call will always be the advice line, which is open 24 hours. They can also call their GP surgery if they need to, because we've got really good relationships with our GPs and district nurses. But if they do need to speak specifically to Dorothy House for advice, then it will be the main advice line number, which is the one port of call.
Okay, that's great, thank you. And what recommendations can you make for supporting breathlessness? Because Emma's mentioned, and I think that's very much in the news at the moment about breathlessness. So Louise, could you just give some advice on that?
Yes, so we look at really the non-drug ways of easing some of the kind of anxiety and worry around that symptom, and that can be for the patient and their family and carer as well, because watching someone who's short of breath can be really, really worrying, because it feels like there's nothing you can do. Looking at simple things, making sure the patient is comfortable, looking at their position. Do they need to sit a bit more upright? Do they need more support for their arms, for their back, for their head, their neck? So simple things around where they're seated, their chair, making sure they have pillows for support. If someone is actually acutely sort of short of breath after getting up and walking across the room, techniques to try and lengthen the out breath, relax the breath down, slow the breathing rate. That not only helps relieve the breathlessness, but it also calms the mind down. So it sort of relieves the anxiety and worry as well. There are simple techniques. Again, we have sheets that will be available on our website with some of the simple techniques that are used. Smell the flower, blow out the candle, the rectangle or table breathing technique is another very common one. They're all there and outlined for people to access and read. We're not really recommending the use of fans at the moment, really due to the worry that that might spread droplets, spray around, but cooling the front of the face, a damp flannel, a splash of cold water, all of those things will help as well. Pain is another symptom that can be used, that you can use kind of non-medication for as well. Hot packs, hot water bottles, gentle heat. Movement is often good for pain, although it may seem counterintuitive really if pain is what you get when you move, but some simple movement, again, a change of position, proper support in sitting or in bed. And those techniques, again, there are diagrams and information on our website.
That's brilliant, that's great, thank you. Another question, I don't know how to properly put on my PPE. Is there any advice you can give on that? Gina, that's coming straight your way.
Yeah. So there is a way to put on the PPE. The Public Health England website is a very good website to look on. There is a video of how to do it on the website, and it tells you when to wash your hands, because it's quite a process. You have to put on your apron, mask, goggles, gloves. That is the order to put them on, and then taking them off. It's a reverse order, but there's lots of hand washing or alcohol gelling in between all of those steps. So, you know, taking off your gloves first, washing from your elbows down, and following the process. But there's a very good video on the Public Health England website under infection prevention and control and non-aerosol generating procedure. It's quite a long video, but it's really worth watching, and it gives you the correct order to do it in and how to do it.
That's great, thank you. With all these changes and new ways in which you interact with patients, will you continue to use any of these practices when the pandemic ends? Oh, Emma.
Good question. Definitely, actually. You know, we've been introduced into this situation. Some of us have kind of varying levels of skill in using this technology, but actually I think we're adapting to it really well, and it's showing us new ways of working. And I think what this will do is enable us to have a really good think about how we can use this in the future, because I definitely think it has a place to be able to support people. So definitely, and I think if we work together on this, I think we'll come out stronger.
That's great, yeah. Another question. My biggest worry is anxiety. Do you have any tips for this? I'm a manager and I have staff members to look after in my home, care home that is, but also patients and family members. So actually I'm going to go for Claire on that.
So if I just touch on I guess professionally, it is really hard at the moment because we do feel like we're carrying our colleagues as well as those that we care for. And anxiety is really high. I think if we can use that peer support, I don't know what the question that person was asking has got in terms of kind of supervision really, but it is about being honest with each other about the anxiety, because it's very real, and continuing to support each other. One of my biggest things in terms of patients and relatives is just giving them reassurance that even though it might look different, that the support is still very much the same, and also reassuring those relatives that the care is still there, even if the relative can't actually give that. I think personally I've just been trying using my peer support, the supervision that we're offered and accessing that, and also when you're not at work, trying to find different ways of switching off and trying to get a sense of normality if you can, away from the workplace.
Great, yeah. Okay, I don't think we have the proper PPE because we don't have respirators or visors. What is your advice, Gina?
So going again, Public Health England guidelines are, we don't need, if you're not doing aerosol generating procedures, you don't need to have respirators or visors. The PPE for non-generating procedures is apron, mask, gloves and goggles. So that is enough. Obviously, if you're doing aerosol generated procedures, then you would need the FFP3s and the visors, but you would have to be fit tested and make sure they fit correctly. So aerosol generated procedures, they are in, I can't see it, can they? There's the COVID-19 infection prevention and control guidelines, and on page 29 of those guidelines there are all the aerosol generating procedures, and it's things like, let me just find the page for you. So intubation, which you won't be doing in a care home, nor us, tracheostomies, bronchoscopies, endoscopies, surgery, some dental procedures, non-invasive ventilation. I guess some care homes may have that, BiPAP, and then you would need to make sure you've got the respirators, but the FFP3 respirators, high frequency oxygen, and high flow nasal oxygen. The other thing that has become an aerosol generating procedure is if you have to insert a nasogastric tube. So if you were doing any of those procedures, then you would have to get fit tested for the FFP3s. But otherwise, for everything else that's non-aerosol generated, then you just need apron, mask, gloves and goggles, and hand washing, hand washing, hand washing, and some more hand washing.
Yeah, I mean, I'm not clinical at all, but even I know about washing hands. So yeah.
Just making sure.
We had a message as well from Linda Dean, who's the Senior Manager, Emergency Management of Baines Council. And this is what she has said, we're working closely with Avon and Somerset Local Resilience Forum on central government drops of PPE. As soon as these arrive, they're being distributed from our central hub. Anyone who requires PPE should go through their respective commissioning manager, who will submit their requests, but please bear with us as they try and meet the demand of everyone. So I think, you know, we all know that it's a pretty difficult process at the moment. Okay, another question. Should training and staff development continue right now? Is Dorothy House still training staff? Emma.
Yes, we are still training staff. It's happening in a different way at the moment, as you'd expect, but our training is very much still ongoing. The first thing to say is that we are introducing resources, new resources onto our website, you know, very frequently. But the other thing is that we're looking at ways of delivering other forms of training that we usually do remotely. So, for example, I know we usually run the advanced syringe training. We are still planning to do that, but you know, probably it will be delivered in a different way. But very definitely, we're still doing training. It's really important.
Okay. And are you still making visits into the community, Claire?
We're working really closely with the district nurses and care homes. If the referrals come in, it really is based on assessment, and it is about reducing the footprint. So again, working really closely with other professionals. But if I think clinically that an essential visit is needed and that I need to go and see that patient, then absolutely I will go and see that patient. The nurse specialists, again, like I said, we are working very differently. We're using telephones, we're trialling video technology, but we recognise that there is still visits needed when it's clinically indicated. So yeah.
Okay, that's brilliant.
And if I can follow on to say that the therapies team, that's occupational therapy, physiotherapy, lymphedema, are still also doing community visits where they're deemed essential. Otherwise, we're trying to manage as much as we can over the phone. But you know, it's not always possible, and we will come and see you. Yeah.
Yeah, can I just add as well that often it's also down to the patient and relatives whether they want us to visit or not. There are some that actually are choosing for us not to visit at this time, so we would never enforce that visit on them. It really is about agreeing and discussing how we are going to provide that care and who's going to be sort of visiting from one time to another. But it may be that the patient and relatives decide that actually at this time they're shielding completely and so they don't want to be visited. So we continue to support them, probably more so and more frequently by using telephone. So I might be phoning my patients every day, for example, whereas I might not have visited them, you know, once a fortnight or once a month, for example.
That's great, thank you. Another question, what should we do with the leftover medications of patients that have died, either if they've had COVID or not? We know we would have to destroy these, but it's a shame, especially that there are uncertainty of the stocks of these medications. We've had to destroy vials of morphine and paracetamol tablets. Claire?
So I think first, and Emma wants to join in a minute as well, but I think first of all, it's really important that we get our prescribing and anticipatory meds prescriptions done appropriately. That's the starting point. And because if we don't over order and we don't over prescribe, then the waste the other side will be less. So it's about what we issue and prescribe initially. And yes, I totally agree that, you know, we don't want the waste. And actually I did send an email to our pharmacist only last week about managing that, really, to make sure that we don't contribute and add to shortage of supply. So it's making sure that our prescriptions are, you know, as good as they can be in terms of reducing the waste of that. In terms of disposal, particularly within the care homes, I would assume that you've got your own procedures and protocols that you would follow. I'm not aware of any new changes that we will be able to reuse or resupply, so I do think it all has to be discarded, but Emma might be able to add more to that.
Yeah, no, thanks, Claire, that's really helpful. But the other thing I was going to say is there is a medicines management group that is one of the things they are looking at is this, and about how we can reduce the wastage of drugs, particularly at the moment. So I don't have any more details. I just know there's a group of people looking at it. But what I would suggest that you do is contact your local pharmacist for your area, whoever asked that question.
Thank you, that's great. Another question coming, is there a central place that you would recommend for support or advice for people working in care homes? Anybody particularly?
Well,
Yeah, go on.
I'll have a go. I guess it depends on what kind of advice that you're after. I mean, I would always say that a good first port of call, it could be our advice line, our 24-hour advice line. We're always happy to take calls, you know, irrelevant of the patient's diagnosis and whether the patient's, you know, known to us or not. The patient does not need to have been known to us before. And often we can point you in the right direction, but I guess it's the type of advice that you're needing. But I don't know if anyone else has got anything to say, but I would have thought that was a good first point of call.
I just remind the people of that number as well. So it's 0345 0130 555. It's 24 hours, so you can ring at any time. Yeah, but also if we have any specific hubs of information for care homes, we'll make sure that those are available on the website after. So we'll make sure that we get our heads together to get some links
yeah,
ready.
and we also, you know, we'll take telephone calls to offer on the phone advice regarding any specific sort of issues or techniques or problems that might arise. And we do that anyway, and we're carrying on offering that.
Okay. I work in a care home, and I'm not me, obviously, this is a question. I work in a care home and I'm concerned about keeping my family safe when I'm exposed to so much at work. Any suggestions for practical steps I can take? But also, I don't want to frighten my family, so discreet ways of handling this would be really helpful. Yes, Claire.
Just because it's a reality, and I'm obviously working from home. I've got 2 children, a husband, a dog, and so, you know, the reality is that, you know, they're very aware of what I'm doing. The children are very aware of what I'm doing. They're very aware of what's around them, and I think it's about being as honest and as real as you can be. Not hiding anything from them, because otherwise the children just come up with their own conclusions. But when I have gone out and come back, I obviously using the universal precautions and the recommendations that have been given. But what we are doing, which we've been doing from the start actually, is when we come back from a visit, I'm coming in through my garage. I'm showering before I get into the house, putting my uniform on a hot wash, and then coming into the house. So I feel that I'm doing as much as I can to separate and kind of, you know, as much as you're donning and doffing your PPE, you also feel like you're completely separating yourself and then coming into the house as clean as possible, really. And again, I think it's just acknowledging that anxiety, and that it's real. But the best protection that we've got is the precautions that we've been advised to use, and we have to, you know, continue to use that as best we can when visiting and coming home.
Does anybody else have anything to add to that? Or Just in relation to the question before as well about information for care homes, a couple of people have said about contacting the commissioners, and within BANES, general advice can come via the commissioners, and I believe an email address will be up on the chat. Brilliant. Sorry, I should have said that before. And how do you support your staff? How can you help best manage well-being, which is a huge issue at the moment, and will, I'm sure, continue to be. So Emma, I'm going to go to you on this one.
I think, I mean, there are lots of ways that we can all support each other actually at this time. But thinking about you in care homes supporting your staff, I think being honest with them, and not, just being honest and upfront with them, but in a calm, sensible way. I think this is a challenging situation, so people will feel anxious. People may have a wobble, as some people are calling it, and I think kind of an understanding that actually that's okay. This is really hard. But I think we need to remember that we're all in this together. There are more formal, there are formal kind of methods of support. Certainly at Dorothy House, we are offering support, and certainly I know. I think, Jen, have you got Anne with you? Because we've got one of our family support team members, our whole family support team are looking at this and what support we can provide to you. I don't know if...
Yeah, so basically what we will do is we will make sure that there's information again on that page on the website, so that you've got some links to go to that can help you and give you some really good tips and advice on that. I think when somebody has said, I'm feeling exhausted, not so much anxious, but just tired, and understaffed, and any tips for that?
I think it's about being kind to each other, and recognizing that we all feel anxious, but we may all feel anxious at different times. And so just being kind to those people that are having a rough time, and let them have a couple of minutes away from the environment. Here at Dorothy House on the inpatient unit, we're very keen if people are having a wobble, to go and have a couple of minutes in the garden and just spend that time just on their own, get their thoughts together, but also to talk to each other. We try every day to have an update once or twice a day, so that we're being honest with the staff about what is happening, and the staff can then share their anxieties as well.
Great, thanks. Another question. I'm a carer for a domiciliary care agency. We've been given gloves and aprons, but not masks. We look after vulnerable elderly clients and LD clients. You've talked a lot about care homes, but what about the carers in the community? Claire, can I go to you on that?
I mean, I can't answer your PPE supply issue, unfortunately, but what I can do is empathise and completely understand the challenges that you face. We know as nurses that we could not do what we do without the support of carers, and we could not do, patients cannot stay at home unless they have care support. It's absolutely crucial. It's a vital service. And it's just so important that you have the right equipment to provide the care that you need, because your service is absolutely essential and it's crucial. And yes, you have to protect yourselves and those that you're caring for. But I can't answer the supply issue, sadly, for you.
Another question. I'm a newly qualified GP, and I'm finding this crisis really difficult. I have two end-of-life patients at the moment. Is there anyone I can speak to for professional advice? Emma?
So I really feel for you. First thing to say, when you're talking about professional advice, I'm going to take it that you mean kind of professional advice about managing your patients. I'm really happy for you to contact me via our advice line and to offer you advice if I've understood your question correctly. I'm really happy to be contacted to try. I should say that I know we keep talking about our advice line, but you know, it is there. It's 24 hours. Our very, very experienced nurses, you know, are able to answer most of the queries, but actually there's always a doctor on call 24 hours as well who may be able to help. So, you know, I would just say, please do call us.
Yeah, and just to add to that, you know, there's a nurse specialist attached to every GP surgery, and we're available Monday to Friday, and obviously the advice line continues with the support of nurses at the weekend as well. So there's open access to the medics and the nurse specialists, and we're easily contactable. So it depends what that professional advice is. But also we are, you know, this is our field, we're experienced in that. And I think also what we're finding, particularly on my caseload, is that I might actually steer the ship in terms of symptom control for the end of life patients, and then liaise with the GP to kind of update on what we've done, really. So it is our field and it is where our experience lies. So I would encourage to use and take up the offer of that support and service, really.
Thank you. Another question. Do you have any advice for caring for a patient with COVID and dementia? Anybody particularly would like to take this?
Okay, oh, go on. Claire, do you want
to... Emma, carry on and then I can add if you want to.
Yeah, Claire, you might be able to add to my answer, but I think one of the things we are seeing with COVID patients is that they quite often are developing quite a profound agitated delirium, so becoming extremely agitated. Now, you know, we've got lots of ways of managing that, but I guess when you add a diagnosis of dementia into the mix, I wonder if that then becomes even more significant. And it's about looking at ways of managing that, and by that I mean the pharmacological, so the drugs, but also the non-drug methods that we would use to help and support someone. And I think particularly for dementia patients, it becomes even more important to try and keep them in a familiar environment. I mean, I'm really happy to talk more specifically about the drugs, but I don't know, Claire, would you add anything to that?
No, really, really similar, really. It's, you know, like I said earlier on in the chat, that COVID is just adding another layer to the illness and frailty of patients that are in our care. So it will always be about assessment, it will always be about the symptom, and how we appropriately treat that, so either through the pharmacological or non-pharmacological approaches. Yeah.
Okay, thank you. And there's quite a lot of difficult conversations, and obviously Dorothy House kind of are experts at the death and dying side of things. I wanted to ask Gina actually just about having those difficult conversations, any tips for that, because it is such a unknown at the moment, in such a strange time.
It is yes, it can be very difficult, and more difficult I think at the moment, particularly with the visitors not being around so much. So you may have to have those conversations on the phone, which does pose more difficulty, I think, because you can't gauge people's reactions as well. And if people are with us on the unit, you can't scoop them up and hug them and do the things that, you know, as nurses we like to do. So I think it is just still being honest with people and using the language that people understand, and just trying to be as sensitive to their needs. And I don't know how it is in the care homes, but on the inpatient unit, for, you know, we're allowing visitors to come at that end of life time to be with their loved ones. And if that means they only want to come for an hour, then that's okay. And if they want to come and stay with them, that is also okay. But it is sometimes it's difficult to judge when it's the right time to phone people and to have that conversation over the phone. So, but I think it is about being open, honest, and using the language that people understand, because it is more difficult over the phone, because you just can't see how people are. I don't know if Claire's got anything else that she'd like to add to that, because you see them at home.
I just think the relationship is absolutely crucial. So particularly in the care homes, like, you know, as carers and nurses within the care homes, you'll have built a relationship with your clients and your residents over a period of time, and I think that can actually be really reassuring for the families that aren't able to access the care home, because they know that they're actually with people that know them and are with them every day. Using the telephone, it has completely changed the communication. But what I have found is that the patients and the families that I'm speaking to really value that. And even though it goes against everything that we would normally want to do, actually they're saying that we feel surrounded because you're phoning us, because actually it's not just us, we're working as a team. So any one patient or family member may have the GP, district nurse, me ringing, physio. So there's a whole team actually remotely around people. But I think when I've had those conversations, and I have had very honest and frank conversations over the last few weeks about people coming to the end of their life. You have to be as clear and as honest as you can, but you don't change your approach. You know, you're still you. And we're still professionals, and it's just providing that empathy and care and compassion, but again, like I've said before, in a different way. And I'm not going to ignore the fact that it's challenging, because it is, and we cannot wait to get back to seeing our patients and relatives. We really can't, but for now, we use what we can in the best way that we can, and still continue to provide the support and care that we can.
Thank you. And Louise, a question for you, just in relation to sort of keeping people's well-being going, you know, exercises and that kind of scenario. Have you got any tips on that?
Well, you know, the guidelines are we're allowed to get out and exercise for up to an hour or whatever the kind of current guidelines are. Take advantage of that if you can. We've been lucky, the weather has been amazing. I'm sure I'm seeing more people running and walking than I've ever seen before. So, you know, if you have that opportunity and are able to get outside, then get outside. There are resources again on our website. You know, we have a relaxation resource, we have a worry, stress and anxiety resource. They're not just for patients, they're for staff and us too. You know, log on, read them, use them. A lot of organisations and apps have made their resources free for this period, so you can join all sorts of exercise groups, online yoga groups, online qigong, tai chi. You know, the response really to this situation and the different way we're having to manage things has been tremendous. Try and take advantage of it. Look after yourselves.
That's great. Has anybody got anything else to add at all, or are we going to start to wrap up in a second? Any other points? No. Okay. But thank you so much. It's really interesting to hear everybody's you know, points of view, and this is something that we'd like to consider sort of doing more regularly. If it's helpful, please do let us know. And if there are any specific themes that you'd like us to cover, we would be more than happy to do that. I just want to check if there's anything else that anybody wants to ask. Anybody listening that would like to ask a final question just before I wrap up? Thank you. You've been an amazing panel. Thank you so much to everybody. And I'm going to hand back over to Kirsty now.
Thanks, Jenny. So thank you to our panel for their insights and to Jenny for chairing. We hope that you found the webinar useful and that we managed to answer most of your questions, but do call our advice line on 0345 0130 555 if you need any further support. To find out more about Dorothy House and the care that we provide and how we're stepping up our support during the COVID-19 pandemic, please visit our website, dorothyhouse.org.uk. A recording of this webinar and other useful resources will be available online at the website. So thank you once again for joining us here at Dorothy House.